Senator from Washington.
Mr. President, I come to the floor to join my colleague from Rhode Island, and I want to applaud him for his diligence in making sure that this debate happened today and his leadership on this issue. It might sound kind of wonky to say that there are a group of senators who have a caucus called the Delivery System Reform Caucus, but we wear that banner with pride because we know that there are savings in our healthcare delivery system, and we want to make sure that they are delivered for the American people. So while some want to talk about cutting people off of service or raising certain ages, we're focused on the fact that there are hundreds of billions of dollars of savings in the delivery system and that it is our job to improve upon them. I like to say to my office team, there's a reason why Ma Bell doesn't exist anymore. The challenge is I have so many young people, some of them don't even remember Ma Bell. But the issue is that the delivery system for telecommunications changed, and look at what it unleashed. A lot of great technology, yes, change, but ways to drive down cost and deliver better access. So that's what we're talking about here with the healthcare system. And my colleague from Rhode Island has had a group now for more than a year that's been talking about these delivery system reforms, and so we're going to come out and try to, on a more frequent basis, have a dialogue with our colleagues about why it's so important. We've taken a small step, a very, very important step led by our senior senator from Washington, Senator Murray, on the budget, but there's so much more we can do if we will include these delivery system reforms. So I want to thank Senator Whitehouse, the senator from Rhode Island, for his leadership on this. I want to talk about just one area today, the area of long-term care services. I authorized a provision in the Affordable Care Act called the Balancing Incentive Payment Program. And while that sounds in and of itself like a wonky title, Balancing Incentive Payment Program, this program is really there to promote home and community-based care over nursing home care. So if you ask any senior, they'll say, well, of course they'd like to receive health care services in their home or in their community. No, they don't want to go to a nursing home. But the discussion has been limited on how much cheaper it is and how much better the care could be for delivery in the home as opposed to nursing home care. According to a survey by AARP, over 90% of seniors age 50 or older desire to remain in their home as long as possible. And we know that home and community-based care is 70% cheaper than nursing home care, 70% cheaper. So for us in Washington State, we thought about this long ago, and we decided that we were going to implement a system to reform our state and put more community-based care in our state and pull Medicaid patients away from nursing home care. So we did that, and we successfully made that transition. So this chart shows you what I was just referring to, that home-based care can be as little as $1,200 a person versus that same person getting care in an institutional facility is $6,000. So we made the transition in Washington State to be predominantly a home and community-based care state. We did that with our own state dollars, our own program, and it was a transition that took place over many, many years. We're kind of the antithesis of what the federal system is. It is still more weighted on a state-by-state basis towards nursing home care. That means people are going into nursing home care and we're footing the bill for more expensive care at $6,000 per person when we could have services in the community that would allow them to stay in their home and get more efficient care. So in 2009, the long-term care budget overall for Medicaid accounted for 32% of the Medicaid expenditure, so $360 billion a year. So you can see that this is an area that is a very expensive area for us at the federal level. And if we could do anything to help change those numbers, we would be delivering an improvement to the system. So when we first made this transition from 1995 to 2008, the state of Washington saved $243 million from this investment. But more importantly, even than just the money, in an article in the Spokesman Review spoke hand story called Dying to Live at Home. Family of Nancy and Paul Dunham, a couple of more than 60 years, said they wanted to age at home. And because of the Medicaid funding for in-home services, they were able to stay in, Mr. Dunham was able to stay in his home until the age of 83. So I'm sure many of my colleagues know people who are getting on in years who prefer to stay at home. But the Balancing Incentive Program, which was in the Affordable Care Act, was the first federal effort that we had that tried to incent states to move away from nursing home care and move towards community-based care. So we put some incentives in the program. So here are the states so far that have taken the federal government in the Affordable Care Act up on this incentive program: New Hampshire, Maryland, Iowa, Mississippi, Missouri, Georgia, Texas, Indiana, Connecticut, Arkansas, New York, New Jersey, Louisiana, Ohio, Maine, and Illinois. So a diverse group of states, I might add. So some states that probably, where governors said they didn't want to support the Affordable Care Act, but yet are taking advantage of this provision. Some states that probably are forerunners of delivery system reform and have done lots of delivery system reform and want to do more. So it's a mix of states, and I think a lot of great examples of those states and what we can do to transition away from institutional care to home and community-based care. So the program authorizes grants to states to increase access to their non-institutional long-term care services, and it supports including structural changes that help streamline the system, conflict-free case management, standardization of assessments, single entry system so that it's not confusing, so that the system is very streamlined. And states have until September of 2015 to increase their long-term care services in the community and support expenditures of these non-institutional based care facilities. So we're very excited that it has had a robust uptake by these states, and I'm encouraged that there has been so much interest shown in changing the political orientation, if you will, of states to how do you deal with long-term care. We know everybody's living longer, and we know that it's going to, as baby boomers retire, be a bubble to our healthcare delivery system. But this is an excellent idea or way for us to deliver better care. So what does it do? As I said in the first chart, $1,200 versus $6,000 in nursing home care, it reduced costs. And reducing those costs have to be a key focus for us. These Medicaid recipients are people who maybe even start on Medicare, but because of the extreme cost of health care at the end of life, end up spending down and end up on Medicaid, end up being a federal responsibility. And if we can reduce those costs by driving more community-based care, it's a win-win situation. The second thing it does is it helps improve quality, because if people can stay at home and get access to the delivery system by these new requirements of making sure that it's case managed and single point of entry and standardization of the home care system, it helps us be efficient about what the quality of care that is being delivered. And again, when you have a community-based setting and either in the home or care delivered through the home, there's lots of ways for us to have checks and balances on the system. Now, I've talked to many people who are in the nursing home industry, and they will say, we like the idea that we're only going to take the sickest patients. We like the idea we're only going to serve people who really need to be there, as opposed to some people who may not be ready for those facilities but end up there anyway just because there aren't the community things to support it. And so besides reducing costs and improving quality, we save money. And so, Mr. President, that's why we're here today, to talk about these important ideas that save money. So this is a simple one, but it's already in place. It's already started. There are many states taking us up on this offer, but it's critical that we understand and score these costs, because they can show how we can save billions of dollars in our healthcare delivery system. So I know my colleagues, some of them on the other side of the aisle, well, all of them on the other side of the aisle, didn't support the Affordable Care Act. Take a second look at what your states are doing. Your states are supporting the legislation, at least through one provision. And I think that when you check and see, you'll see that that one provision is going to save your state money. It's going to give your citizens better choice in their quality of care. It's going to help us reduce our federal costs and expenditures as well. And that's what